Okay, so today we are going to present the projects that you had to do in English for Science for different diseases. The first one who is going to present her project is Ellison. Ellison is going to present something about the diabetes. Go on, Ellison.
Okay, good morning. My project talks about diabetes, and the first topic we're going to go about the diabetes is an overview of this disease. Um, Diabetes is a disease that occurs when your blood glucose, also blood sugar, is too high. And this is the main source of energy that comes from the food we eat. Over time, having too much glucose in our blood can cause many health problems, and these health problems are called the complications, that is diabetes. Even though it's a disease that has no set cure, you can manage steps to take the diet to manage it little by little and stay healthy. And there is also a little paragraph that was before this that I have described how our hormones, insulin and glucagon, can actually control the levels of blood sugar. And if these levels are too high or too low, these hormones can dysfunction and cannot be able to retain the levels anymore at a steady pace. So for the next slide,
Okay.
for the next slide, we have the cause of diabetes. The type 1 diabetes is caused by the immune system destroying the cells in the pancreas that make insulin. This causes diabetes by leaving the body without enough insulin to function normally. The type 2 diabetes are usually multifactorial, and it means that one more diabetes cause can be involved. And this is the most overwhelming factor because it can be also affected by family history and also by um, the way that we manage our lifestyles as of now. And type 2 diabetes has fewer symptoms, and they're like easier, so anybody can be confused if they have type 2 diabetes or not. There are also a number of risk factors that increase the chance of developing gestational diabetes. This one is caused during pregnancy, um, that such as family history, overweight or obese, suffering from polycystic ovary syndrome, or having a baby weighing over 9 pounds.
Okay.
This
Mhm.
is an overview of the symptoms, of the main symptoms. There's no specific for each diabetes, but it can be increased thirst and urination, increased hunger, fatigue, blurred vision, numbness or tingling in the feet or hands, sores that do not heal, and unexplained weight loss. As I said before, the symptoms of type 1 and type 2 diabetes can develop at their own pace. Type 1 develops a lot faster, but type 2 can develop very slowly over the course of the years because these symptoms are very light that nobody can even notice them. That's why we should take care. For the next slide,
Okay.
we have the diagnosis of this disease. How can we know for sure that we have this type of disease? Well, the easiest way is by doing a blood test and controlling the levels of your blood sugar, if it's is too high or too low. This is mainly done by healthcare professionals that can diagnose the diabetes, pre-diabetes, and gestational diabetes. I've also done um, in a cluster the types of tests that we can actually determine whether we have diabetes or not. For type 1, we can do the TrialNet test. For type 2, there is a test called MediaCare. For gestational diabetes, we can do the glucose test challenge between 24 and 28 weeks of pregnancy. Then there are the other types of tests, but these one can determine our pre-diabetes if we are close to having any type of diabetes, like the fasting plasma glucose test. After we have fasted for 24 hours, professionals take our blood levels. Then there is A1C test. There is the random plasma glucose test, the glucose challenge test, and the oral glucose tolerance test, where they use the samples from our spit and analyze the levels of sugar and the blood sugar in them. Then there is the treatment. The treatment, of course, can vary because diabetes is a very delicate disease. But the main thing that the professionals suggest is the healthy eating and physical activities. Um, Contrary to popular perception, there's no specific diabetes diet. Of course, we need to focus more on the healthy stuff, such as the vegetables, the greens, and try to go further and further away from the artificially processed foods. Sugary foods can be okay once in a while, but as long as they're like controlled a bit with your meal plan. Understanding what and how much to eat can be a real challenge because nobody sometimes diabetes can be very difficult to manage because there comes a sudden sense of hunger, so it's recommended to get a dietitian. Then of course physical activity is super important as always, because from this we can also control the other diseases that come, not just diabetes. Everyone needs some type of exercise. For diabetes, it's mainly recommended aerobic exercises to lower our blood sugar levels by moving the sugar into our cells where it's used for energy. And we can also increase the sensitivity to insulin, and means our body will need less insulin to transport sugar to our blood cells and stuff. So this was all. I hope that it was. I hope that you became a bit more aware about the common disease that is growing nowadays. It's called diabetes. We should take care of ourselves and our health. Thank you.
Elison, I have a question about you.
Yeah.
Do you think that diabetes nowadays is one of the most dangerous diseases, and why?
Yeah, of course. It's a very dangerous disease because we can say it's one of those rich people diseases that anyone can have. Like diabetes does not discriminate for any one of the class or their ethnicity or race, because anybody can have this. And what's more dangerous about it is the family history. As we said before, one of the main causes of diabetes is a very complicated history of someone having diabetes, which means that children or the descendants will share the same disease. We can also say that because of the use of technology, we are being more exposed and prone to eating artificially processed food because of our very fast and very hectic lifestyle, which means we will have less time to take care of our body, which means we will do less healthy eating and less physical activities, which of course raises the risks of getting diabetes. So that's why I think it's very dangerous, and we should take care of ourselves.
Okay.
Because there was a very concerning study that showed that a lot of kids, especially our age, were developing symptoms similar to diabetes. They were mild, of course, but they were bound to develop over time.
Yeah, this is good. Okay, you have done a good job actually. I liked your project a lot, and also your explanation about the answer. Okay.